The patient breathes pure oxygen at this increased pressure for about 90 minutes per session, typically for a series of 1 to 3 sessions. Studies have shown that HPOT can reduce the risk of long-term neurological damage and improve outcomes in case of severe monoxide poisoning. It is important to seek immediate medical attention if you suspect carbon monoxide poisoning and to receive appropriate treatment, which may include HBOT as soon as possible. Administration. Hyperbaric oxygen therapy HBOT is administered in a specially designed chamber called a hyperbaric chamber, which is designed to deliver oxygen at increased atmospheric pressure. During HBOT, the patient enters the chamber and is placed to a comfortable bed or seat. The chamber is then sealed and the pressure is gradually increased to the prescribed level, which is typically 2 or 3 times the normal atmospheric pressure. The pressure is maintained for a period of time, typically between 60 and 120 minutes, depending on the condition being treated. HBOT should be administered only under the supervision of trained healthcare professional in a specialized chamber hyperbaric facility. It is important to follow all instructions provided by the healthcare professional to ensure safe and effective treatment. Safety concerns and potential risks of HBOT. Hyperbaric oxygen therapy is generally considered safe when administered by a trained healthcare of professional in a specialized hyperbaric facility. However, like any medical procedure, there are some potential risks and safety concerns associated with HBOT. Here are some of the most common safety concerns associated with HBOT. Barotrauma. The increased pressure inside the hyperbaric chamber can cause barotrauma or injury to the body's tissue caused by change in pressure. This can include ear pain or damage, sinus pain, and lung damage. Oxygen toxicity. High concentration of oxygen delivered during HBOT can cause oxygen toxicity, a condition that can cause seizures, visual damage, and other symptoms. Fire hazards. Pure oxygen is highly flammable and there is a risk of fire in the hyperbaric chamber if proper safety precautions are not followed. This is the picture of hyperbaric oxygen chamber. Now we will move toward my second topic, high flow oxygen therapy HFOT. High flow oxygen therapy is a type of respiratory support that delivers a high flow rate of a humidified oxygen to a patient through a specialized device such as nasal cannula or a face mask. This type of therapy provides a higher concentration of oxygen than standard oxygen therapy, which typically delivers oxygen at a lower flow rate. High flow oxygen therapy can deliver up to 60 liters of oxygen per minute, making it suitable for patients with severe respiratory distress or those who require a high concentration of oxygen. High flow oxygen therapy is often used in the treatment of conditions such as acute respiratory failure, chronic obstructive pulmonary disease, COPD, pneumonia, asthma, exacerbation. It can help improve oxygenation, reduce work of breathing, and decrease the need for invasive mechanical ventilation. Principles of high flow oxygen therapy. The principles of high flow oxygen therapy involve the following: high flow rates. High flow oxygen therapy delivers a high flow rate of oxygen to a patient, typically ranging from 20 to 60 liters per minute. The high flow rate helps meet the patient's inspiratory demand and ensure a sufficient supply of oxygen. Humidification. The high flow nasal cannula system incorporates a heated humidifier. The high flow of oxygen can dry out the respiratory tract. So humidification is essential to add moisture to the delivered oxygen Humidification prevents the drying of the nasal passage, reduce comfort, and help maintaining mucillary function. FiO2 control. High flow oxygen therapy allows precise control of fraction of inspired oxygen. The fraction of inspired oxygen represents the concentration of oxygen in the inhaled air and can be adjusted to meet the patient's specific oxygenation needs. This control is necessary for the optimizing oxygen delivery and avoiding unnecessary oxygen exposure. This is the pictorial representation that how the HF40 is done. Now continuing to my topic, nasal design. High flow oxygen therapy is delivered through a specialized device called a high flow nasal cannula. The nasal cannula consists of two small prongs that fit into the patient's nostrils, allowing a high flow of oxygen directly into the nasal cavity. The design of nasal cannula minimizes discomforts and maximizes patient tolerance and facilitates effective oxygen delivery. Positive and expiratory pressure (PEP). High flow oxygen therapy provides a mild positive pressure at the end of expiration known as positive end expiration pressure. PEP helps maintain airways patency, prevents alveolar collapse, improves oxygenation, and reduces the work of breathing. Monitoring and assessment. Continuous monitoring and assessment of patient's clinical condition, oxygenation, respiratory rate, and other vital signs are crucial during high flow oxygen therapy. Regular evaluation ensures mechanism of action of high flow oxygen therapy. The mechanism of action of high flow oxygen therapy involves several physiological effects that contribute to improve oxygenation and respiration support. The key mechanisms are as follows. Oxygen delivery. High flow oxygen therapy drives the high flow rate of oxygen directly to the patient's airways via specialized nasal cannula. The high flow rate ensures a conditioned supply of oxygen, meeting the patient's inspiratory demand and compensating for any dilution of inspired oxygen caused by the patient's breathing pattern. Washout of anatomical dead space. The high flow of oxygen therapy helps wash out the anatomical dead space, which refers to the air that occupies the conducting airway and does not participate in gas exchange. By flushing out these dead spaces, high flow oxygen therapy reduces the rebreathing of exhaled gases and enhances the efficiency of oxygen in change in the alveoli. Positive and expiratory pressure. High flow oxygen therapy can provide a mild positive pressure at the end of expiratory known as PEP. PEP helps maintain airways potency, prevents alveolar collapse, improves oxygenation, and reduces the work of breathing. The application of PEP helps maintaining a consistent level of pressure within the airway, enhancing oxygen exchange, and improving lung compliance. Reduce airway resistance. The high flow of oxygen generated by the therapy can help reduce airway resistance. The reduction in resistance occurs due to flow laminar nature, which promotes optimal airway opening and decreasing the effort of required for breathing. As a result, the work of breathing is reduced and the respiratory muscle fatigue is minimized. Humidification. High flow oxygen therapy incorporates a healthy humidifier to add moisture to the delivered oxygen. The humidification is essential to prevent drying of the respiratory tract, which can lead to discomfort, nasal congestion, and inspired mucillary function. By maintaining adequate humidity, high flow oxygen therapy improves patient comfort and optimizes respiratory function. HF40 used for acute respiratory therapy. High flow oxygen therapy is a valuable treatment option for patients with acute respiratory failure. It provides several benefits that can help improve oxygenation, reduce the work of breathing, and support respiratory function. Here's how high flow oxygen therapy is used in the treatment of acute respiratory failure. Oxygenation support acute respiratory failure often results in adequate oxygenation of the blood, leading to the hypoxemia. High flow oxygen therapy delivers a high concentration of oxygen directly to the patient's airway, ensuring optimal oxygenation. The ability to deliver high flow rates helps meet the patient's inspiration demand and compensate for any ventilation perfusion VQ mismatch, improving oxygen exchange in the alveoli, decrease working of breathing. Patients with acute respiratory failure often experience increased work of breathing due to lung pathology such as pneumonia or acute respiratory distress syndrome (ARDS). High flow oxygen therapy can reduce the work of breathing by providing a continuous flow of oxygen, reducing airway resistance. The positive end respiratory pressure (PEP) generated by the therapy helps keep the airways open, improve lung compliance, and reduces the effort of required for breathing. Now we will discuss high flow oxygen therapy for the treatment of COPD. High flow oxygen therapy can be beneficial for patients with chronic obstructive pulmonary disease (COPD) in certain situations. COPD is a chronic respiratory condition characterized by airflow limitations and often leads to reduced oxygenation level in the blood. Here's how high flow oxygen therapy is used in the management of COPD. Acute exacerbation. During acute exacerbations of COPD, patient may experience worsening symptoms, including increased shortness of breath, decreasing oxygen level, and respiratory distress. High flow oxygen therapy can provide immediate oxygenation support by delivering a high concentration of oxygen directly to the patient's airway. It helps improve oxygenation, relieve respiratory distress, and stabilize the patient's condition. Oxygen during exercise. COPD patients often have difficulty with oxygenation during physical activity due to improved lung function. High flow oxygen therapy can be used during exercise or physical exertion to maintain adequate oxygenation and prevent desaturation by delivering a high flow rate of oxygen. It compensates for the increased oxygen demands and helps patient engage in physical activity with reduced respiratory distress. Palliative care. In advanced stage of COPD or end of life situation, patients may experience severe dyspnea and require palliative care. High flow oxygen therapy can provide comfort by relieving respiratory distress and improving oxygenation. It helps patients breathe more easily and enhance their quality of life during palliative care. Winning from mechanical ventilation. In some cases, COPD patients who have been on invasive mechanical ventilation may undergo weaning to transition to less invasive respiratory support. High flow oxygen therapy can be utilized as a step down therapy during the weaning process. It provides supplemental oxygen while reducing the level of ventilatory support, helping patients gradually adapt to lower level of respiratory assistance. However, it is crucial to note that high flow oxygen therapy (COPD) should be carefully monitored and adjusted based on the patient's condition and response. Excessive oxygen supplementation can lead to hypercapnia. Administration and treatment protocols of high flow oxygen therapy. Patient's assessment before initiating high flow oxygen therapy, a thorough assessment of patient respiratory status should be conducted, including vital sign, oxygen saturation level, respiratory rate, and overall clinical condition. This assessment helps determine the appropriateness of high flow oxygen therapy and guide ongoing monitoring. Equipment setup. High flow oxygen therapy requires specialized equipment capable of delivering high flow rates of heated and humidified oxygen. The specific device used, nasal cannula, mask, etc., will depend on the patient's need and comfort. The equipment should be properly assembled, ensuring a secure fit and appropriate flow setting. Oxygen flow rate. The flow rate of high flow oxygen therapy is typically higher than conventional oxygen therapy. It can range from 20 to 60 liters per minute, depending on the device used. The flow rate should be adjusted based on the patient's oxygen requirement, clinical condition, and response to therapy. Regular reassessment of patient's oxygen saturation level is essential to guide flow adjustment. Safety concerns and potential risks. While high flow oxygen therapy is generally considered safe and effective, there are some potential risks and safety concerns that healthcare providers should be aware of. These include oxygen toxicity. Prolonged exposure to high level of oxygen can lead to oxygen toxicity, which can damage lung tissue and other organs. This risk is generally low with high flow oxygen therapy, as the oxygen concentration delivered is often not 100%. However, it is still important to closely monitor oxygen saturation level and adjust the therapy as needed. Airway dryness and bleeding. High flow oxygen therapy can cause drying of the respiratory mucosa, leading to discomfort, dryness, potential nasal bleeding. Proper humidification of oxygen should be ensured to minimize this risk. Regular assessment of patients' nasal passages and intervention, if necessary, can help prevent complications. Infection risk. The warm and humid environment created by high flow oxygen therapy can promote bacterial growth. Strict adherence to infection control protocols, proper cleaning and maintenance of equipment, and regular monitoring of the patient for sign of infection are crucial to mitigate the risk. Now we will discuss some similarities between HBOT and HFOT. HBOT and HFOT is similar in many ways, like oxygen delivery. Both HBOT and HFOT deliver oxygen to the patient at higher concentration and compared to normal atmospheric air. HBOT involves breathing 100% oxygen at pressure higher than sea level. The HFOT deliver high flow of heated and humidified oxygen to the patient. Respiratory support. Both therapy provides respiratory support to patients with respiratory insufficiency. HBOT is often used in conditions such as decompression sickness, carbon monoxide poisoning, and non-healing wounds, while HFOT is used in various respiratory conditions where there is a need for higher oxygen concentration and flow rates. Improved oxygenation. Both therapy aim to improve oxygenation in the body. HPOT increase the oxygen content in the blood and tissue by delivering oxygen under increased pressure. F, HFOT improve oxygenation by delivering a high flow of oxygen directly to the patient's airway, helping to meet the patient's increased oxygen demand. Tissue healing. Both HBOT and HFOT have potential benefit for tissue healing. HBOT promotes wound healing, reduces tissue of hypoxia, and enhance oxygen delivery to compromised tissue. HFOT may also support tissue healing indirectly by improving oxygenation and reducing respiratory distress in patients with respiratory conditions. Now I am going to discuss differences between the HBOT and the HFOT. As HBOT and HFOT are two different therapies, so they also have differences. Like in HBOT, the patient is placed in a specially designed chamber where they breathe 100% oxygen at increased atmospheric pressure. The pressure can be up to 3 times higher than sea level. On the other hand, HFOT involves the delivery of a high flow of heated and humidified oxygen through nasal cannula or mask. The oxygen flow rates used in H40 are typically higher than used in traditional oxygen therapy, but significantly lower than the pressure used in HPOT. Discussing about the pressure, the primary character of HPOT is the increased atmospheric pressure in the chamber. The pressure helps to increase the amount of oxygen dissolved in the plasma and tissue. On the other hand, HF40 does not involve pressurization. The oxygen is delivered at ambient pressure, and the primary focus is on delivering a high flow rate of oxygen to meet the patient's respiratory demand. Another difference between HBOT and HF40 is their application. HBOT is primarily used in conditions such as decompression sickness, carbon monoxide poisoning, gas embolism, non-healing wounds, example diabetic ulcer, radiation injuries, and some neurological condition, example air or gas embolism, decompression sickness, and non-healing wounds. While HFOD is used in a variety of respiratory conditions where there is a need for higher oxygen concentration and flow rates, it is often used in acute respiratory failure, exacerbation of chronic obstructive pulmonary disease, COPD, acute hypoxemia, respiratory failure, and post-extubation respiratory support. Now I'm going to discuss the conditions that are typically better suited for each therapy. First of all, I will tell you about the HBOT. As we have studied the condition before, like decompression sickness, decompression sickness, carbon monoxide, non-healing wounds, radiation injuries, and gas gangrene. Uh, the decompression sickness, the HBOT is the primary treatment for decompression sickness, a condition that occurs when nitrogen bubbles form in the bloodstream due to rapid ascent from diving or high altitude exposure. On the other hand, carbon monoxide poisoning, HBOT is an effective treatment for carbon monoxide poisoning as it helps to rapidly eliminate carbon monoxide from the body, improve tissue oxygenation, and prevent long-term neurological complications. Non-healing wounds. HBOT promotes wound healing in conditions such as diabetic foot ulcer, arterial ulcer, and non-healing surgical wounds by improving tissue oxygenation, reducing inflammation, and stimulating new blood vessels. Radiation injuries. HBOT can be beneficial for patients with radiation-induced tissue damage such as osteocrosis, radiation cystis, and radiation proctis. Gas gangrene. HBOT is often used as adjunctive therapy for gas gangrene, a life-threatening infection caused by certain bacteria that produce gas and toxins. Now discussing the applications of HF40. These are application respiratory failure, chronic obstructive pulmonary disease, COPD, post-extubation respiratory support, acute hypoxemic respiratory failure, and palliative care. Now I will discuss a small discussion about them. HF40 is commonly used in the management of acute respiratory failure, particularly in the patient with hypoxemic respiratory failure who require high level of oxygen support. Chronic obstructive pulmonary disease, COPD exacerbation, HF40 can be beneficially managing COPD exacerbation by improving oxygenation, reducing work of breathing, and helping to avoid invasive mechanical ventilation. As for HF40 is used as non-invasive mean of respiratory support following extubation in patients who may still require oxygen supplementation and have an increased risk of respiratory failure. In acute hypoxemic respiratory failure, HF40 is an option for patients with acute hypoxemic respiratory failure who do not require invasive ventilation but require higher oxygen concentration and flow rates. Palliative care. HFOT may be used in palliative care setting to improve comfort and oxygenation in patients with end-stage respiratory disease. Now discussing about the summary of hyperbaric oxygen therapy. Hyperbaric oxygen therapy is a medical treatment that involves breathing pure oxygen in a pressurized chamber, typically at higher atmospheric pressure than normal. This pressure is used to increase the amount of oxygen dissolved in the blood, which can promote healing and improve various medical conditions. The treatment is generally considered safe when administered by a trained medical professional. However, there are some potential risks and contain contradictions such as a middle ear problem, certain lung conditions, certain types of cancer. Therefore, it is essential to undergo HPOT under guidance of healthcare provider experience in this therapy. Discussing about the summary of HF40, as we have learned that studied that HF40 is a form of respiratory sport that deliver a high flow of humidified oxygen to a patients ever it is used to provide supplementary oxygen to individuals with respiratory distress or failure who may not be adequately supported by conventional oxygen delivery methods. HF40 offers several advantages over traditional oxygen therapy method. It can provide a more precise and consistent oxygen concentration, reduce the work of breathing, and improve oxygen without the need for intubation or invasive mechanical ventilation in some cases. It can also help flush out carbon monoxide, provide positive and expiratory pressure, and improve mucillary clearance. The therapy has been used in various clinical settings, include emergency department, intensive care units, and post-operative care. It is particularly beneficial for patients with acute respiratory failure, chronic obstructive pulmonary disease (COPD), acute exacerbation of asthma, or those are at risk of respiratory failure. Here are the reference links for hyperbaric oxygen therapy where you can study more. And here is the reference link for high flow oxygen therapy. Thank you for listening me. Allah Hafiz.